What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, February 8th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and other viruses that could be a threat to your health. We also do talk about what is going on with the latest air qualities, because let's face it, air quality can impact our health as well. The air we breathe in, guess what? It could have bad particles, could be bad for our health. So if you like this type of content, maybe you want to be informed with what's going on with these viruses, subscribe to my channel down below. If at the end of today's video you enjoyed this, give it a thumbs up and share this with anyone you know. Share it on your social media pages. Alrighty, starting off today, we've got to start off with a topic that I wasn't certain I was going to add into today's update, but I feel we need to. Not wearing a mask during COVID outbreak isn't free speech. New Jersey appeals court says. And yes, I agree with this. It is not free speech. So what they're referring to here is back in the beginning of the pandemic, way back in 2020. I know it's been such a long time. There were a lot of people that were just upset that they had to wear a mask at board meetings, and they thought it was a violation of their freedom. I mean, there were a lot of different cases where that popped up in 2020. Well, the court says, no, it's not a violation of your freedom to have to wear a mask. One of these masks, well, most people were cloth or surgical back then, but it's not a violation of your freedom to do it because we were in a public health emergency at the time. And it was for everyone's safety. And of course, as you know, it just wasn't New Jersey. This was all across the country, and many of these school board meetings were on the subject of masks because people were not upset that their child had to wear a mask in school. People said various silly different things about it. It was just an absolute disaster. And my opinion is, you know what? If you have to wear a mask for a safety precaution during a pandemic such as the one that is going on right now, it never ended. COVID has not ended yet. It's not ending anytime soon. And if you have to wear a mask to help keep yourself and others safe, then by all means, just do it. Don't argue about it. It's a simple safety measure. All right, that's enough about this subject. We have a lot of other things to talk about. Elderly with Omicron pneumonia and bacterial infection often have functional decline a year later. Just reading that headline, it's not good. This is coming from Japanese research among patients that are 80 years or older hospitalized with COVID. And yeah, they found significantly higher rates of decline in those infected. Yeah, it's not good. And we do have something else. Another study. COVID-19 behind thousands of excess U.S. deaths. Analysis shows. A new study from researchers at Boston University of Public Health and the University of Pennsylvania showed that a substantial portion of excess mortality numbers counted as deaths from natural causes during the COVID-19 pandemic. I hate that word during, because we're still in a pandemic. So in other words, it is still happening, were actually attributed to the novel coronavirus, and it's still happening right now. Even as we speak, deaths are still being undercounted. You'll be able to find both of these studies. Eventually, I will add them to my website. We're actually going to show my website today. We haven't done that in a while in one of these videos. All right, Mitchell Marsh. He's an Australian cricketer, or cricket player, I should say. I don't follow cricket, so I'm not really up to date on the sport, but I do know this much. Mitchell Marsh tests positive for COVID ahead of Wendy's T20 IS opener. Again, I'm not really into this sport, so I don't know much about it, but what I do know is this. I've been seeing multiple news stories about cricket players testing positive and then being allowed to play cricket at the same time. I mean, hello. What's the deal here? If you're positive for COVID, you should be sidelined, you should be put in quarantine, you shouldn't be allowed to play, because I mean, they're even saying, oh, well, they'll social distance. Okay, it's still a risky behavior. You could pass it on to other people. It's just silly, if you ask me. All right, moving on. Speaking of silly, I have to share this. Beware! Ohio schools are closing due to highly contagious illness. You're going, what? Highly contagious illness? Let's read the article because this is just totally ridiculous. Ohio is at the peak of cold and flu season, leaving many residents having to call out of work and school. Aside from those suffering from the cold or flu, another highly contagious illness has recently affected students and staff at Ohio schools. Numerous call-ins have led school officials to shut down schools completely. Yeah, this is just totally ridiculous disorder. Ohio isn't the only state getting hit with this, quote, illness. Half of the states in the U.S., including Ohio, reported very high flu activity according to the CDC. The problem is getting ahead of these illnesses to avoid taking time away from work, school, or spending time in the hospital. Recently, schools in Ohio were forced to shut down due to the amount of students and staff who were sick or absent due to illness. They say the word illness many times. They say highly contagious illness, but no one wants to say that infamous C word. COVID. Hello. Why can't you just say the C word? COVID. Totally ridiculous. Speaking of Ohio, we do have weekly COVID-19 case drops that have occurred in Ohio. This is the weekly COVID update for Ohio, and it says here, weekly COVID-19 case drop for 5th week coronavirus update for Thursday, February 8th, 2024. So cases are dropping once again in Ohio. The number of new COVID-19 cases in Ohio continued a downward trend this week from 7,468 to 7,197. Now, they're saying it's a downward trend, and yes, that is down. That's not an absolutely big drop. I mean, 7,468 versus 7,197. That's still a lot of cases. And you have to remember, these guys right here, these lovely at-home tests do not get counted. And plus, it's Ohio. It's a red state. I know I don't like to bring politics into this channel, but sometimes you have to. It's a red state, so there's a lot of people that don't even bother to get tested, especially in rural Ohio. It's a real problem. So the fact that their numbers only came down that little amount, yeah, that's not good. All right, there were 12 people admitted to the ICU, bringing the total since 2020 up to 15,722. And then it says here there were also 91 Ohioans who died from COVID-19 related issues. So, yeah, they had 91 deaths in the last week. Alrighty, continuing on. I promised you we would show you my website today. Here we go. I have added a ton of things in the last 24 hours, and I'm not done yet. There's more things. I have those 2 studies from today. I have another browser window full of things that need to be added yet. So if you have not seen my website, it's datareport.info. It's really a forum. I call it a website because I do leave a few links up here to various different things that we discuss on this channel. There's also a section where you can view a lot of the data that I look at here and share on the channel. I have to update that thread as well, but I mean, you can find a wealth of information here. We have information about news on COVID treatments, COVID legal cases, COVID studies and papers. That's an ever-growing section. We have an archive of COVID positives. We also have a COVID outbreak archive, which, by the way, that is going to be getting yet another change. United States COVID outbreaks, I'm going to be splitting that up like school outbreaks, hospital outbreaks, and I think I'm going to also make another section within here for musicians or bands. I think that just needs a section of its own because there's been a lot of them over the past several years. Then we talk about all kinds of other viruses as well. We recently added the measles section, so check that out down below. All right, moving on now. Oh, by the way, real quickly, I should remind you, it's free to sign up and become a member to my website. It's absolutely free, and you can post on here if you want to. All right, moving on now. Air quality today. It's not so great in the east, but I'll say this. It's better than it was this morning. The west coast is not doing too bad, but you see a lot of yellow in the east and even some orange. And these places that are seeing orange here along the I-95 corridor from like DC to New York, that's better than it was this morning. There was a lot of red showing up, so we'll take the improvement, but again, it's not the best of air quality day in the eastern United States. If you want to learn more about that, and of course, how, you know, climate can affect your health, such as air quality, or just the weather that's going on, I have a channel where we do just that. There'll be a little link card down below. You can click on that. It's called Climate Data Report. And the big thing we're talking about right now is the potential for a storm that is going to impact the Mid-Atlantic and Northeast early next week, and then a pattern change behind that. with colder weather. Taking a look at the latest data from Walgreens, and we will see on Walgreens that the COVID positivity in the United States has dropped by 0.7% to 26.6% versus 27.3%, and testing is slightly down. All right, I do want to take a look at some wastewater sites here. I got them written down, believe it or not, which ones we want to take a look at today. And first off, we have to zoom in here. Really close. There actually is a wastewater site in Wheeling, West Virginia. We have not looked at this one in a really long time. And for COVID, it's still high. It was dropping, but most recent updates suggest maybe it's trying to go back up again. We'll have to see if that's noise or if that continues down when they update it again. And that is as of February 5th. This is a wastewater site with 100,000 population. RSV. It was dropping. It's still high. It's leveled off a little bit now. Influenza A has tried to rise a little bit. Influenza B continues to rise. That's at high. Norovirus is rising, also at high levels. And look at this. There was a detection of an Mpox case back on December 15th of last year. Now let's go down to the south. We have to take a look at New Orleans. Why? Because, well, Mardi Gras is coming up pretty soon. So we're going to take a look at New Orleans this week. Then we're going to look again next week and the following week and see if there's any sort of a trend going on there. And right now, COVID levels in New Orleans, they're high. And the overall trajectory, yeah, it did come down a little bit, but look at this. You can see here, it's not really dropping all that much anymore. It's kind of almost tried to rise a little bit, flattened out. It's not doing the drop that it was doing at the end of December, so that's not something we like to see. High for that, high for RSV, high for influenza, and influenza A is rising once again. Influenza B was rising again, now it's starting to drop. Again, that's a good thing. Norovirus is high. Most recent update shows it may be starting to drop. And taking a look here, hepatitis A has been detected back last year, and you can see last year there was a detection of Mpox at this wastewater site, which has 333,000 population. This is the east side of New Orleans. We're not going to look at the west one today. And now we have to go out to Dallas. You may have noticed I had that on the screen here before we started this. And taking a look here, let's just go to Sunnyvale, Texas, shall we? See what's going on there. And we can see here, no, we don't want to take a look at this wastewater site. We want to go to Dallas right here, because it's doing that silly thing where they keep the, all right, they're doing it here too. Alrighty. See the charts here. They've been keeping the charts really low for some reason. COVID's coming in at high. It's flat at this time. RSV is high but flat. Influenza A, slightly rising at this time. Influenza B did have a significant rise, then it leveled off. Now it may be trying to rise yet again. Some hepatitis A detection last year. And look at this, there also was an Mpox detection last year as well. Now we want to switch over to the CDC website, and I will show you why. Here we go. Look what we can look at here. Something we have not looked at in quite a long time, and that is Arizona. Very important that we take a look at Arizona. We're going to look at a couple wastewater sites here. You can see La Paz. Hopefully I'm saying that correctly. Only 3,500 population, but on the most recent update for you, which looks like it is back in January at this time, you are rising ever so slightly, and we have to really zoom in here. There is one wastewater site in the red here. We're going to get this right in the Phoenix, Arizona area, Maricopa County. Wow, look at this. And this looks like hasn't updated since the middle of January, but still worth showing in my opinion. At that time, it was in the red, 50,000 population, and it was rapidly rising at that time. It's good to see these wastewater sites even showing up on the CDC website, because we have not seen them in a very long time. Yuma at this time, which looks like this one did update a little bit sooner, end of January. Only 8,200 population. It is dropping at this time. Alrighty, moving on now. Taking a look here. COVID deaths in the past week. Yeah, they're still occurring, and they're still occurring at high numbers. They actually went up ever so slightly. You can see anywhere that's in the yellow is still seeing increases of COVID deaths, and even some of these green counties, there's a few in between that are still seeing a few death increases here and there. Like, take a look at this. Minnesota, it did go up by 12.1%. So, yes, it is still a problem. JN.1 is still a variant in lead at 93.1%. Taking a look now at Philadelphia. 784 EMS incidents for Wednesday. That is a good bit higher than the previous day. Let's do a live look in at Montgomery County. And sometimes it's not the volume of calls, it's the type of calls. Borderline that way today. Not a lot of calls, but there are some right now. We're seeing several general weakness, several cardiac emergencies, respiratory emergency, stroke's never a good thing. So yes, there are some calls to be had right now. And Chester County is busier than when we looked at Chester County yesterday, which was a little bit later than today, but take a look at this. Multiple respiratory calls, and even a call for heart problems. That's never good to see. All right, New Jersey, what is your deal? Just 2 hospitals reported today. 2 out of 70, 2 equal 82 hospitalizations. I'm not even going to continue on with New Jersey because that is just silly. Let's take a look at New York State. 3,009 new cases added in New York State today. Taking a look at the statewide level for hospitalizations, 1,808 people in the hospital, 195 people in the ICU. Again, you can see here, it's not dropping as fast as it was, or at least yesterday it wasn't. Today's a little bit faster because Long Island did actually drop today. I'm going to zoom this in. I want you to see Long Island because if you were watching yesterday's update, you noted that Long Island did have a bit of an increase, and Long Island today, while it is down from yesterday, it's still higher from where they started the week. 373 hospitalizations in Long Island, 48 in the ICU, and just to be fair, I will show New York City. Here's New York City. New York City is going down like a little staircase here. You can see it continues to go down. 763 people in the hospital and 95 in the ICU. New York City always has the highest number for state. It's one of the biggest areas in New York State. All right, Colorado this week. Hospitalizations did drop to 154. Cases this week, though, were up ever so slightly, 2,554. That's up by 379. Chicago, we had an update there today. Hospitalizations are down to 17. Beds in use, 2.7% down. Emergency department visits down by 1.4%. Laboratory confirmed cases, though, did rise ever so slightly by 148. So that is what their new number is, 148. That's up. And take a look at vaccinations. Unfortunately, not enough people were vaccinated in the past week. I don't know why. It's showing up, but it's red. I don't know what that's all about. Usually when it's up for vaccination, that's usually a green up arrow, right? So it's 5,472 people either got a dose or got some sort of the COVID vaccination. All right, Washington this week. Good news all across the board. Emergency department visits for COVID, influenza, RSV, all down more than 20%. Hospital admissions down by 29% for COVID, 10% for influenza, and down 29% for RSV. Influenza dropped by 3 people in the ICU, and COVID ICU, it held steady for the past week. All right, let's see. Did we get the update from Massachusetts? I have to refresh this. They're supposed to come in around 5 p.m. Yes, it finally updated. 12.5% of all emergency department visits were for respiratory illnesses. Influenza is moderate. COVID is low, and COVID hospital admissions is low. Remember, low is not the lowest category. Minimal is the lowest category. All right, let's take a look at something that I don't think I've ever showed before. A dashboard I've never showed before. Tennessee. Let's take a look at the number of people in the hospital for COVID in Tennessee. Currently, inpatients, 340, and 44 people are in the ICU. You can see that their number peaked on the 5th of January at 656, and 82 people were in the ICU. Let's also go back. Can we take a look at other data? I believe we can take a look at some other data here. Let's click on COVID-19, and let's just take a look at EPI. I think this is what we want to click on here. And you can see here, COVID-19 cases. Yes, you can see COVID-19 cases. They were dropping through much of early last year, and then you can see here it peaked right around the 3rd of January. They were dropping, but if you take a look here, it almost looks like it's leveling off a little bit. The most recent update were 632 cases on the 2nd of this month, so they haven't updated in 6 days, so that really doesn't matter much. The thing we cared to see was hospitalizations are dropping in Tennessee, and that's a good thing to see. First time we've looked at this dashboard, so it can get a little jumbled, and maybe we'll find some more states that still have COVID dashboards that update. I'm always up for finding states that are still updating their dashboard. Eventually, We are going to check all 50 states. Wouldn't that be great? Alrighty, folks, that does it for today's pandemic update. We will have another pandemic update again tomorrow. If you learned anything here, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below and share this with all your social medias, family, friends, whoever. We need to get the word out. The pandemic's not over, and that there is still someone who reports on this daily, 7 days a week. I will see you guys all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.